Good afternoon. I'm Dr. Tapia, and today I'll share an auto-heuristic exploration of my experience as both patient and healthcare professional living with dialysis for more than 12 years. This study captures my personal journey, but it also reflects broader issues faced by dialysis patients in the Philippines. Dialysis in the Philippines remains a significant burden. Before reforms, PhilHealth only covered 90, even before that 45 sessions per year, leaving patients to shoulder the cost of remaining sessions. Many, myself included, had to skip life-saving treatments. Sometimes I would alternate 1 to 2 times per week. This context became the backdrop of my journey, one where I experienced firsthand the challenges, inequities, and eventual reforms. My study aimed to explore my lived experiences undergoing dialysis across different settings, public, private, and freestanding centers. You have seen pictures in the first slide, whether on vacation or regular dialysis in Manila, in Cebu, while also reflecting on what these mean for patients, health systems, and me as a doctor patient. I use auto-heuristic inquiry, which combines heuristic reflection with self-immersion. Aside from memory recall, I revisited years of personal writings. You see, I was a blogger. I am still a blogger, member in fact of the Cebu Blogger Society, Facebook posts, TikTok updates, and patient group discussions to reconstruct the depth of these experiences. During the analysis of this study, the study underwent several phases, and these are the phases and what happens during each phase. And for the results, there were key findings or themes, four emergent themes, in fact, that came out. Number one, survival and vulnerability. First, dialysis is both survival and vulnerability. My own stroke, I did not expect this to happen. Recurrent hospitalization due to recurrent kidney infections and near-death experiences show how fragile this journey can be. At the time during Odette, where when I just had the stroke, I I I thought I would die already. I won't survive. Second, dialysis reflects deep inequities. Public centers were crowded, under-resourced, and emotionally draining. Doctors are not really able to make rounds of all the patients, and you will see patients sometimes where who make makeshift blankets out of cartons of dextrose dextrose boxes and cover their dialysis chairs with it. Now, in contrast, private centers offered comfort and dignity. In fact, I often look forward to be dialyzed because it would mean seeing my favorite programs such as Flash, Supergirl, or the NBA playoffs. Third, I saw patient empowerment at work. I started with the local support group, establishing the Smiling Kidneys Club, and then later through Dialysis PH, a small Facebook group that grew to 85,000 members. We engaged PhilHealth and shaped reforms. Meetings with staff of congressmen and senators, as you can see in the picture. During dialysis, I am sitting there on a dialysis chair during meetings. Uh, we lobby until we reach PhilHealth, where we tell what is there on the ground, so they will have an idea. And as a result, we now have these changes from 90 sessions to 144 during the pandemic, and then 256. And with the latest field circulars, we have free erythropoietin, we have free injections of iron, free laboratories that are routine for dialysis patients. These are victories we fought together, from skipping treatments to improve compliance, and from silence to collective advocacy. Finally, dialysis remains a paradox, a burden of complications as a result of secondary hyperparathyroidism, for example, or heart failure, yet also a blessing with improved access, expanded coverage, and hemodiafiltration. My journey highlights how patients can reshape national health policies, even from the dialysis chair. Yet inequities remain, especially in staffing, amenities, and doctor availability in public centers. As both physician and patient, I see opportunities to bridge these gaps and design systems that prioritize both care and dignity. You see, dialysis is not enough. We have to preserve patients' dignity. To build on our progress, we must sustain policy reforms, ensure equitable care, and invest in future innovations, like, for example, hemodiafiltration, while continuing to strengthen patient advocacy. Public dialysis centers need more resources, constant supply, especially now with this new PhilHealth circular. As Mr. Howie Severino, a renowned journalist, has said and reminded me, your voice as both doctor and patient would be uncommon. Navigating dialysis as both doctor and patient offers a unique vantage point. Physician patients can play a transformative role in advocacy and system improvement. And so I'm starting to begin with TikTok, and later I hope to influence more people. In the end, this journey is more about than my survival. It's about transformation. Transformation of myself, of the patient community, and of policies that once seemed immovable. My experience as both doctor and patient allowed me to witness suffering, solidarity, and hope, and turn them into advocacy and action. This work would not have been possible without the patients, caregivers, advocates, and healthcare professionals who continue to inspire me